Hi everyone, welcome to all. This is Vidyam Academy's NEET Initiative Most Expected Question Series. This is Rajiv Patel. Today's topic is 12th Biology, the third chapter, Reproductive Health. Into this chapter, the subtopic is Sexually Transmitted Infections, Infertility, MTP. Let's welcome to all. Let's get started. The first question, in which year was the Medical Termination of Pregnancy MTP Act passed in India and what was its primary purpose? Option A, 1952 to control population growth by making all abortions free and mandatory. Option B, 1971 to legalize safe medically supervised abortions and reduce maternal deaths from unsafe illegal abortions. Option C, 1983 to allow abortions only when the mother's life is in immediate danger. Option D, 2002 to introduce emergency contraception as an alternative to surgical abortion. What is the right answer for this question? Option B, the primary purpose of MTP Act in India, which was passed 1971, to legalize safe medically supervised abortions and reduce maternal deaths from unsafe illegal abortions. So before 1971, abortions was illegal in India and women seeking to end unwanted pregnancies were forced to undergo unsafe illegal procedures performed by untrained persons in unhygienic conditions, leading to thousands of maternal deaths every year from infections. So here the Medical Termination of Pregnancy Act was passed in 1971 to end this public health crisis by legislating abortion under carefully defined medical and social conditions, ensuring that the procedure could only be performed by registered medical practitioners in approved facilities. The act was not meant to be used as a primary contraceptive method. It's a backup measure for situation involving contraceptive failure, risk to the mother's physical or mental health, the fetal abnormality, rape, and pregnancy resulting from failure of contraception. By bringing abortion into the legal and medical framework, the MTP Act gave women reproductive autonomy and dramatically reduced maternal mortality from unsafe abortions across India. So that's what 1971's Medical Termination of Pregnancy Act, which was passed, and the primary purpose is legalize safe and medical supervised abortions and reduce maternal deaths from unsafe illegal abortions. Let's move to question number 2. Under the MTP Act 1971 as amended in 2021, up to what a gestational age is medical termination of pregnancy allowed for the general category and what is the extended limit for special categories? Option A, up to 12 weeks general, up to 20 weeks special categories. Option B, up to 20 weeks general, up to 24 weeks special categories including rape survivors, minors, women with disabilities. Option C, up to 20 weeks only, no special categories exist under Indian law. Option D, up to 28 weeks for all categories with only one doctor's opinion required. What is the answer? Option B is right answer for this question. Let's see why and how. The original MTP Act 1971 allowed termination up to 12 weeks with one registered medical practitioner's opinion and between 12 to 20 weeks with the two practitioners' opinions. The upper limit was 20 weeks for all categories. The MTP Amendment Act of 2021 made a significant change by extending the upper gestational limit to 24 weeks for specific vulnerable categories. So it might be rape survivors, victim of innocent, minors, girls under 18, women with disabilities, women whose marital status changed during pregnancy such as widows or divorcees, or cases of substantial fetal abnormality incompatible with life. For cases involving several fetal abnormality detected after 24 weeks, a medical board of specialists can authorize termination even beyond 24 weeks. The woman's own written consent is always sufficient. No consent from a husband, parent, if adult, or any other third party is legally required. See, let's move to question number 3. Which of the following correctly matches a sexual transmitted infection, STI, with its causative agent? Option A, gonorrhea caused by Treponema pallidum. That's a bacterium. Option B, syphilis caused by Treponema pallidum, a spirochete bacterium. Option C, HIV/AIDS caused by herpes simplex virus, HSV. Option D, the chlamydia caused by Neisseria gonorrhea, a bacterium. What is the right answer? Would you guess the right answer? Option B is right answer for this question. Why? See here. Sexually transmitted infections are caused by a wide range of pathogens. So bacteria, viruses, fungi, and parasites. And matching each disease to its correct causative agent is a high frequency requirement. The syphilis is caused by a Treponema pallidum, a spiral-shaped bacterium called a spirochete, so which is correctly identified in option B. Gonorrhea is caused by Neisseria gonorrhea, not Treponema pallidum, so making option A is wrong. HIV or AIDS is caused by human immunodeficiency virus. HIV is specifically a retrovirus, not the herpes simplex virus, making option C also wrong. So chlamydia is caused by chlamydia trachomatis, not a Neisseria gonorrhea, making option also D is also wrong here. So other important STI pathogen pairs are here. Genital herpes, herpes simplex virus type 2, HSV2. So genital warts, human papilloma virus, HPV, hepatitis B virus. So trichomoniasis and trichomonas, so vaginalis, a protozoan. So option B, syphilis caused by Treponema pallidum, a spirochete bacterium is the right answer for this question. And next move to question number 4. Which of the following is most effective measures of preventing the spread of sexual transmitted infections including HIV? Option A, taking oral contraceptive pills daily to prevent STI transmission. Option B, consistent and correct use of condom during every sexual act. Option C, avoiding STIs by taking antibiotics after every sexual encounter. Option D, using copper IUDs which create an environment hostile to STI pathogens. What is the right answer for this question? The right answer is option B. It's very simple, as you know, consistent and correct use of condoms during every sexual act. Sexually transmitted infections spread through direct contact with infected body fluids, either blood, semen, vaginal secretions, or through skin-to-skin contact in the genital area. The most reliable way to prevent this transmission is to create a physical barrier between partners, which is exactly what condoms do. A condom, when used consistently and correctly during every sexual act, physically prevents contact with the infected fluids and skin, blocking the transmission pathway of a bacterial STIs like syphilis, gonorrhea, and chlamydia, as well as a viral STIs like HIV, herpes, and hepatitis B. Oral contraceptive pills are hormonal drugs that prevents pregnancy but do not do anything to block pathogens transmission. Antibiotics after sex wouldn't prevent viral STIs like HIV and herpes at all. And regular antibiotic use promotes drug resistance. So copper IUDs prevent pregnancy through spermicidal copper ions inside the uterus have no mechanism to block STI pathogens. Among all contraceptive methods, the condom is the only one that simultaneously prevents pregnancy and STI transmission. Next, move to question number 5. A couple is said to be infertile if they are unable to conceive despite unprotected sexual intercourse for a defined period. Which of the following is correct regarding infertility? Option A, is always caused by problems in the female partners only. Option B, infertility can result the problems in either male partner, female partner, or both and is investigated in both partners equally. Option C, infertility is defined as a failure to conceive within 1 month of trying. Infertility, option D, infertility always requires IVF treatment and cannot be treated by any other method. So these are all the options A, B, C, D. What is the right answer for this question? Option B is the right answer, which exactly the question demands for. Let's see the explanation, why and how. Infertility is defined as the inability of couple to achieve conception after 12 months of regular unprotected sexual intercourse, or 6 months for women above 35 years. It is important to understand that infertility is not condition that exists in one partner alone. It's a couple's condition and problems can originate in the male and the female or both partners simultaneously. Male factor infertility includes low sperm count, oligospermia, we can call it as, no sperm in ejaculate, we can call it as azoospermia, abnormal sperm morphology, it's called teratospermia, and poor sperm motility, it's called asthenospermia. The same way in a female factor infertility including anovulation, failure to ovulate, blacked fallopian tubes, endometriosis, uterine fibroids, polycystic ovary syndrome, PCOS, and hormonal imbalances. So many cases of infertility can be treated through relatively simple interventions. So hormonal therapy, surgical correction of blacked tubes, and intrauterine insemination without needing the more complex and expensive IVF procedure. Assisted to reproductive technologies like IVF are reserved for cases where simpler treatments have failed. So this is the right explanation of question number 5. Let's move to question number 6. Which of the following correctly describes the assisted reproductive technology called GIFT, GIFT, a zygote intrafallopian transfer? Option A. GIFT involves transferring gametes, egg and sperm directly into the fallopian tube where fertilization occurs inside the tube. Option B. Zygote intrafallopian transfer involves fertilizing the egg outside the body and the other transferring the resulting zygote or early embryo into the fallopian tube. Option C. ZIFT involves injecting a single sperm directly into the cytoplasma to egg to achieve fertilization. Option D. ZIFT involves placing the embryo directly into the uterine cavity at the blastocyte stage. What is the answer? Option B is the right answer. Let's see the explanation. Assisted reproductive technologies are specialized procedure used to help infertile couple to achieve pregnancy. So here, zygote intrafallopian transfer is two-step process. The first one is the eggs are retrieved from woman's ovaries and fertilized in a laboratory with the partner sperm, just like in an IVF. Creating a zygote outside the body, then unlike a standard IVF where the embryo is placed in the uterus. In GIFT, the zygote are very early embryo at the 8 cell stage or earlier before that, transferred into the fallopian tube where it travels naturally into the uterus for implantation. This is different from GIFT, gamete intrafallopian transfer, which is described in option A. In GIFT, unfertilized gametes, egg and sperm together, are placed into the fallopian tube and the fertilization happens inside the tube naturally. Option C describes ICSI, intracytoplasmic sperm injection. Option D describes standard IVF ET. That's what option B is the right answer for this question. Next, move to question number 7. Which of the following statements about sexually transmitted infections are correct? Option A. All STIs are caused by bacteria and can be completely cured by a single dose of antibiotics. Option B. Early STIs often produce no symptoms, which is why they spread silently. Infected individuals may unknowingly transmit them to partners. Option C. STIs can only be transmitted through sexual intercourse and cannot spread through blood transfusion or sharing needles. Option D. Once a person is cured of an STI, they develop permanent immunity and cannot be infected again. What is the right answer? Option B is the right answer. Let's see how and why. One of the most dangerous features of many sexually transmitted infections is they are often asymptomatic in their early stages. Infected individuals look healthy, feel fine, and have no visible symptoms, yet they carry active infection and can transmit it to sexual partners during the silent phase. This is particularly true for Chlamydia, the most common bacteria STI worldwide, gonorrhea, genital herpes, which can be transmitted even where there are no visible shows, which may cause only a mild flu-like symptoms initially before a long symptomatic phase, and hepatitis B. This asymptomatic spread is the primary reason STI continue to be a major public health problem. People do not seek treatment because they have no symptoms, and they unknowingly infect partners. So option A is wrong because of viral STIs like HIV, herpes, and genital warts caused by HPV cannot be cured with antibiotics. Option C also wrong because HIV and hepatitis B are also transmitted through infected blood products, and shared needles, and from mother to child. And finally, option D is wrong because STIs like gonorrhea and chlamydia confer no lasting immunity and can reinfect the same person repeatedly. That's what. And next, move to question number 8. Consider the following statements about assisted reproductive technologies, ARTs. Statement 1. In IUI, intrauterine insemination, the husband's or donor sperms are collected, processed, and injected directly into the uterus of the female partner to facilitate fertilization. Statement 2. In ZIFT, gamete intrafallopian transfer, the egg is fertilized outside the body and the resulting zygote is placed into the fallopian tube. Statement 3. ICSI, intracytoplasmic sperm injection, is used for severe male infertility where a single sperm is injected directly into the cytoplasma of the egg to achieve fertilization. Options are, all 3 statements are correct. Only statements 1 and 3 are correct. Option C, only statements 1 and 2 are correct. Option D, all three statements are incorrect. What is the answer for this question? Option B here is the right answer. Why and how? Let's see. So 1 and 3 are correct. Let's see why and how. The statement 1 is correct because intrauterine insemination is one of the simpler ART procedures where semen is collected from husband or a donor in cases of severe male infertility or azoospermia. The sperm are processed and concentrated in the laboratory to select the healthiest and most motile ones, and the one are injected through a thin catheter directly into the uterine cavity during the woman's fertile window. So placing the sperm much closer to the fallopian tubes where fertilization naturally occurs. This greatly improves the chances of a sperm reaching the egg compared to natural intercourse. Statement 2 is incorrect here. Why statement 2 is incorrect? Let's see. This description is a zygote intrafallopian transfer, not GIFT. In GIFT, gametes, that is the unfertilized egg and sperm together, are placed directly into the fallopian tube, and fertilization occurs inside the tube naturally, not outside the body. Statement 3 also correct because ICSI is a highly specialized procedure performed under a microscope where a carefully selected sperm is physically injected into the cytoplasma of a mature egg using a very fine glass needle. It is the treatment of choice for severe male factor infertility, azoospermia, when sperm can be surgically extracted. Let's move to question number 9. So here we have assertion A and reason R. Medical termination of pregnancy should not be used as a regular method of birth control or contraception. Reason R, MTP is a surgical or medical procedure that carries risk including infection and anesthetic complications, and repeated MTPs can cause damage to the uterine lining and fallopian tubes, potentially leading to future infertility. Option A, both A and R are true and R is the correct not explanation of A. Option B, both A and R are true, so R is the not correct explanation of A. Option C, A is true but R is false. Option D, A is false because MTP is an acceptable and safe regular birth control method. What is the right answer here? Option A is right answer because both A and R are true and R is the correct explanation of A. Why and how? Let's see. Assertion A is completely true because MTP should not be used as a regular contraceptive method. The MTP Act itself was not designed to provide routine family planning but do offer a safe legal backup in specific situations such as contraceptive failure, risk to health, the fetal abnormality, or pregnancy from rape. Reason R is also true because provides the precise medical explanation for why MTP cannot be used routinely. So every MTP procedure, whether surgical, vacuum aspiration, so dilation, or else medical, so carries inherent risks including infection of the uterus and the tubes, incomplete evacuation requiring repeat procedures. That's what. So beyond the immediate risk, repeated MTPs cause progressive damage. The repeated dilation and inflammation of the uterine cavity can cause a scarring, weaken the cervix, and cause pelvic inflammatory disease that can block the fallopian tubes. All of it significantly reduce future fertility. This argues the exact medical and biological reason why A is true. The procedural risk and long-term fertility consequences are is the correct and right explanation of A and conferring option A. And the final question, the 10th question now here. Arrange the following events in correct chronological order describing the progression from HIV infection to AIDS. PQRSTU. Option P. HIV enters the body through unprotected sexual contact, infected blood, or mother-to-child transmission. Q. HIV specifically target and destroy CD4, T lymphocytes, helper T cells. Or acute retroviral syndrome, mild flu-like symptoms for 2 to 4 weeks. Yes. Clinical latency phase, the person appears healthy but HIV continues replicating. D. T. CD4 T cell counts falls below 2000 cells. Immune system severely compromised. U. Opportunistic infections, TB, pneumocystis, pneumonia, Kaposi sarcoma, develop AIDS diagnosed. So guess the right answer of this consequence for the sequence. What is the right answer? Option B correctly as sequences are matched here. When HIV enters the body, the first response is a brief acute retroviral syndrome, a flu-like illness with fever, swollen lymph nodes, and fatigue lasting 2 to 4 weeks as the immune system mounts an initial response to the large amount of the virus suddenly present. After this acute phase, HIV begins its specific and systematic attack on CD4 T lymphocytes, the helper T cells that coordinate that entire immunoresponse. This ongoing destruction of CD4 cells enters the clinical latency phase. Yes, the person feels completely healthy and may show no symptom for months to years, but HIV is actively replicating inside lymph nodes and progressively depleting the CD4 and cell population. Eventually, years later, the CD4 count falls critically to below 200 cells per microliter. At this level, the immune system is so severely weakened that it cannot be defended against the pathogens that a healthy immune system would easily control. This opens the door for opportunistic infections like organisms like Microbacterium tuberculosis, pneumocytes, and Cryptococcus, and cancers like Kaposi sarcoma that now cause life-threatening disease and the clinical diagnosis of AIDS. Acquired immunodeficiency syndrome is made. So here we explained 10 most important and expected questions for your upcoming NEET examinations. And next, I will come up with another topic which are very important for your NEET examination. Till so far, I would like to conclude this session with very well goodness. Thank you, and thank you so much to all.